For a long time now, there have been a lot of people expressing concerns about the impact of various social media platforms on young people. You know the stories, you know the arguments, but this has all gone to a new level recently, and with us here to talk about it, our tech guy for 207, Rich Brooks from Flight New Media in Portland. Thanks for coming in, Rich. This is a topic that a lot of people are going to be interested in, and what prompted our discussion is that the Surgeon General of the United States recently issued a recommendation that social media platforms should come with a warning about their possible impact on the mental health of young people. So what exactly is it the Surgeon General is saying here?
Yeah, so I think what Dr. Vivek Murthy is saying is that there is a crisis, a mental health crisis for adolescents, and that social media is playing a critical role in that. And his suggestion is we put Surgeon General warnings on social media platforms that basically state that there is a link between social media and mental health issues in youth. And he kind of brings up tobacco as an example, like how they put the warning labels on tobacco, and the amount of Americans who smoke is so much less because of that, although he does admit that that was part of a larger campaign and all of those things work together.
So what are some of the specific problems that he points to as justification for this recommendation?
Yeah, and there are a lot. So one thing is that teens are spending a lot of time on social media. In fact, research shows that some of them are spending more than 3 hours a day on social media, and that has a negative impact on their sleep and their nutrition and how they're doing in school. There's also research that shows that kids feel worse about themselves and their bodies after being on social media, especially true in teenage girls. And then there's the issue of cyberbullying, which has led to countless teen suicides across the country. And then there's also the concern that these platforms are getting sensitive data from children who may not understand what they're sharing. Those and some other reasons are a lot of the causes why he wants these things passed.
This recommendation that social media platforms have warnings has not been met with universal acclaim. What are some of the arguments on the other side that are against this?
Yeah, I think there's always going to be part of the population that feels like almost anything is government overstep. So that's part of it. But even beyond that, there's no long-term research that's been done to find out what is the impact of social media on developing teen brains. And then there's always the issue of causation versus correlation. Like, is social media causing kids to become depressed? Or is it that kids who are already suffering from some level of depression are more drawn to social media? And the other flip side is, unlike tobacco, there is an upside to social media. It can be a force for good. I mean, I know when I was growing up, after school or after dinner, I'd be on the phone for hours with my friends, and I think social media plays a similar role today. And also you've got this whole marginalized group, especially the LGBT youth community, where they're not getting the support or understanding at school or at home, so they're turning to social media to find their peers who are going through the same thing. It can be a real lifeline.
So one of the arguments among proponents is that warning labels helped reduce tobacco usage. Warning labels could be beneficial for young people who are on social media platforms. What do you make of that argument?
I think that's one analogy, but another analogy would be as the warning labels that appeared on rock albums and comic books back in the day and video games, all of which came about for the best of reasons with a lot of hand-wringing and like, think about the children, Rob.
Yeah.
But I know when I was growing up, if I saw those warning labels, I was more likely to buy those video games or those record albums. So I'm not really sure that it has much of an effect that way.
All right, so whether we see warning labels in the future or we don't, what advice would you give to parents who are legitimately concerned about these issues?
Yeah, and even though I've gone through this myself, I wouldn't call myself an expert, so I actually reached out to my dad, Dr. Robert Brooks, clinical psychologist. He's been on this program before, and also looked at the American Psychological Association's website and the Mayo Clinic's website to see what they said. And from those three sources, basically came up with the ideas of start by understanding your kid. You understand them better than anybody else. You know the maturity level. Set a minimum age for getting on social media. Stick with that, even if their friends get on. Another thing is limit the amount of time per day they're on their screens and on social media, and consider a time where they have to give up their phones for the night, like so that they're not scrolling into midnight. And then also model the behavior you want to see in your kids. You can't expect kids to get off TikTok if you're at the dinner table scrolling through Facebook the whole time. So a lot of that comes down to the behaviors that you're modeling for your kids.
Do as I say, not as I do.
Oh, yeah.
Every parent knows that line. All right, good advice. Thank you, Rich. We appreciate it. And if you'd like a summary of the points that Rich has made, you'll find them. Just head to the 207 section of our News Center Maine app or website. Stay with us. We'll return with more right after this.